Hello everyone, welcome to my channel biomed at Prachi. Today we are going to discuss about questions related to ICU department. It's natural that patient relatives become much worried about and have series of questions in their mind when patient is admitted in ICU. I have tried to include most frequent questions and answers related to ICU. Please comment in comment box if anything still popping in your mind. So before starting, please subscribe to this channel for more such informative videos. Very first question comes in mind is what is ICU? Long form of ICU is intensive care unit. It's a special ward or room in hospital which takes intense care of patient and monitors their health by 24 by 7 hours. Next question is why patient need ICU or which patients get admitted in ICU. Let's understand that if any patient is very much ill or immunocompromised who needs continuous attention of clinical team and treatment get admission in ICU. And yes, these patients may need intense hygiene environment, so it's become compulsory to admit patient in ICU as all the things are not possible at home. One most important factor is that as these patients are at intense risk of health, hospital continuously monitor their health on vital monitors which are capable of keeping record of vital parameters for 24 hours. So by grabbing and identifying all these needs, hospital decides such patients to admit in ICU. Now, many patient relatives and people think about what treatment is given in ICU. First of all, one have to put down all the burden of worries about patient once the patient is admitted in ICU. Because ICU is not only a special room to keep patient in isolation, but also surrounds with highly trained clinical staff, highly trained technical staff, a specialist doctor called intensivist, and most important, they have specialized equipments for intensive health care. A pin drop movement in patient health also catched by system and staff, so the clinical help is provided at the same moment. Many people think about what is going on behind the curtains. Let's understand that it is totally depends on what kind of illness to patient. Some patients may need continuous monitoring and heavy medication after major surgery, so are kept on syringe pump, infusion pump and connected to vital monitors. Some patients may have collapse systems like multiple organ disorders. These patients are kept on heavy medication dose and ventilator support. Ventilator provides breaths to patients who cannot breathe themselves. Sometimes if needed to save the patient from situation of heart attack, doctors may use defibrillator on patient to give the shock. Defibrillator can save patient's life during heart stroke incident. For detailed information about defibrillator, that how it works, you can visit link in description box. Mostly patients in ICU are bedridden. So for diagnostic purpose if needed, procedures like ECG, EEG, X-ray or sonography are done using portable equipments in ICU only. Many times patient in ICU got their airway passage filled with mucus, saliva or sputum due to prolonged use of ventilator. Then clinical team perform a procedure on patient called as intubation to remove the fluids from airway passage. This procedure is generally performed behind the curtains. There are many possibilities of treatments and procedures in ICU, and I think all are done very carefully by ICU staff. They know their duty very well, so on the toes always to serve. Our next question is what are ICU monitor readings? Let's know. You can see in image very first parameter is ECG. It is a graphical presentation of heart rhythm along with ECG waveform. It also shows parameter HR that is heart rate. HR is the number of times heart pumps blood in the body. Next parameter is respiratory rate. It denotes the rate of breathing per minute. Respiratory waveform represent inspiratory and expiratory breathing phases. Next is SpO2%. It denotes the percentage of oxygen in the blood. And then EtCO2 and temperature. EtCO2 is the amount of carbon dioxide coming out of patient's lung and temperature measures inner body temperature continuously. Last parameter is NIBP. NIBP measures blood pressure non-invasively at certain intervals. Many people are curious about different sounds coming from ICU. These sounds are mostly from these patient monitors because the sensors attached For all these different readings are very much sensitive. A small movement of parameter range makes alarm, or if patient moves, parameter may get disturbed and then monitors detect as it's something wrong, so it makes alarm to get attention of medical team. Also, the parameters like NIBP, SpO2 and HR makes beep sounds at their particular intervals. Ventilator also makes sound if anything gone wrong with patient circuit or parameter of ventilator. All these sounds are made just for safety purpose of patient's health and nothing else. For the patients who coming out of health risk, there is allowance of muting the alarming sounds. I think this small conversation definitely given most answers of questions related to ICU. In next video, we will discuss new topic. Till that, keep learning, do your best. Bye bye.